Hello, and thank you guys for joining us. I learned we are the last thing stopping you from lunch, so it better be good. But luckily, we get to talk about food today. My name is Kwame Liddell. I'm the founder and CEO of Nutrable. Nutrable is a app and a care management company that navigates patients to everything that's not specifically healthcare, like food, housing, transportation, so the doctors can focus on the things that they need to. And I'm joined here with some incredible panelists. And we talked about this, and I said I could read their bios, but I think it's just so much more interesting if they presented themselves. So we'll start with Morgan, and we'll go down the line.
Cool. Hey, everyone. I'm Morgan Flannery. Good to meet you. I'm the SVP of strategy for a company called Season Health, which is, as we'll talk about, in the food is medicine space. So I spend a lot of my time talking to payers and providers. I've been there close to the inception of the company, so about 2.5 years old. Came from the world of outpatient behavioral health before this, and started my career more on the VC side, but have chosen the sort of Sisyphean world of healthcare startups as my personal career path, for better or for worse. But good to be here.
I'm Ashley Trenier. I'm the founder and CEO of Farmbox RX. I founded the company actually as a direct-to-consumer entity about 10 years ago. Worked alongside Sam Kass during the Obama administration. Sam was a senior policy advisor to the Obamas for nutrition, the executive director of Michelle Obama's Let's Move. We worked together to help create the pilot to accept SNAP and EBT online as a form of payment. Through my food policy work in 2019, I found out CMS was changing regulation around food and produce to be offered as a benefit. Went out in 2020 to find a plan to work with us then. No plan wanted to work with us then, but I found one. And so now we're solely a healthcare company, and we have to date, I think we actually just pushed to 91 health plans, logos that we work with. Where food is medicine at our heart, but a big piece of us is actually food is engagement. We get members, Medicare and Medicaid, to go take a quality initiative in their health in order to continue to get more food. So go get a flu shot, get your mammogram, get a farm box. So that's why we say where food is engagement at the end of the day.
Hey everyone, my name is Smriti Simi, two names, one person. Background is robotics and public health. I work with Tata, TATA, it's a global company. I spearhead their strategy for healthcare and life sciences in North America. I'm also the head of strategic marketing. I'm also a raw vegan chef and nutritionist, so I work passionately with the public health, worked some with the LA County, also with the White House, advising them about food insecurity and how we can lift and shift our vulnerable population across the globe as well. And I represent India with one of the largest organizations called the Akshaya Patra, which feeds 2 million kids a day for the last 22 years. So lovely to be for the rest of the panel here.
And thank you. And actually, you mentioned something. You said food as engagement, and I think that applies to all the work, the work that all of you all do. Talk to us about how food can drive engagement with patients, and perhaps some examples from the work that you all do.
Yeah, sure. So at the end of the day, it doesn't matter how much food that we put in front of an individual. If they don't engage with the food, it's for nothing, right? So that goes on many different levels, down to cultural needs. You want to send something to someone that inspires them in their culture cooking. Like, I'm Mexican, and so my fridge on one side of my family looks very different than I'm half Mexican, half white, than the other side of my family, right? And there's a really common misconception, and I talk about this a lot, that just because somebody is low income, they don't want to eat healthy and they don't want to be healthy. They want to be healthy, they want to eat healthy, they don't have access, they can't afford it, and they don't know what to do with it. So when you engage somebody in giving them the tools that they need in order to be healthy, they're more apt to take a self-efficacy journey in their health, doing things like going to get their mammogram, their colonoscopies, their diabetic eye exams. And also it's around strategic, really, utilization of other benefits, because what we've uncovered and what we've done in programs. I'll use Molina Healthcare of New Mexico was the program that actually changed us into a food as engagement company. We were able to unlock and teach members about other benefits that they have available to them, like transportation. They'd call us and they'd say, I would love to, continue to get these deliveries of food, but I can't go get this flu shot that you're asking me to go do. And we were able to say, no problem, Mrs. Smith, you have transportation provided to you in order to go to your doctor, to your pharmacy, even down to medication adherence. We actually proved to move the needle up on medication adherence because we were able to educate members on mail order pharmacy. A lot of seniors don't know about mail order pharmacy. And we even had seniors calling our call center saying, I thought I could get arrested if I had my medication delivered to my door. So it's really around educating members, the tools that are actually available to them through other benefits in order to maintain their health.
I think maybe the only thing I'd add to that is like food in and of itself is something we all think, you all are thinking about it right now, right? You want to go to lunch soon. So you think about it all the time. We engage with our patients on average 3 to 4 times a week. I bet a lot of you are doing work around recentering around the pharmacist as a role. I think food can play a very similar role. We're talking to folks all the time. We have a feature of our application that allows you to text your registered dietitian. So they're texting in saying like, hey, I'm at Thanksgiving, or I'm, in the grocery store and they don't have asparagus. What can I substitute? And so it's just a really, as we build that trust, we have a ton of access to our patients. And then I think you guys have done an incredible job of like, now that we have their ear, what do we want to actually do with that? But food, yeah, it's an incredible driver of engagement.
Yeah, and I think my perspective, expanding on both your answers, I think there are 2 sides to the coin. One, I think, is the accessibility and the affordability to get access to good food. The other side, I find there are a lot of us who are privileged, but we still don't eat well, right? So I think there's a behavioral health format to it, and there's obviously affordability format to that. And from my perspective, a lot of apps and programs that can be integrated in the physician's one-on-one contact to really make that needle move, to make them healthier. But I think health starts at home. So it starts from culture, starts from our parenting, starts from our education, starts from a community. So I think, we all have to start there to really move the needle across, all the touch points.
Thank you for that. Those are some really insightful answers, and especially when you guys talk about the examples of how you can educate patients. And when I think about that and looking at health plans, we see that patients oftentimes have multiple options to think about where they get their food from and how they are engaged. So I'd like to ask you guys, how do you view competition in this space? It seems like even on stage, there are potential competitors or collaborators. Is it the more the merrier mentality, or does competition impact the way that you work?
I'm happy to start there. Actually, we like to say that we were actually the first to market of getting a payer to cover food, right, as a benefit. We welcome the competition. We truly look at that as space makers, that it's a viable space. So as other people have come into this market, we look that they complement us and they actually are helping prove our ROI. Because I was looked at like I had 4 heads by VCs years ago, and I was like, I want to deliver food to individuals on Medicare and Medicaid, and let me tell you how I'm going to do that. And so we really like to say that we don't have to own the entire market. We just want to have a seat at that table within the market. So people like Seasons, or there's Nourish also in the space. They're very different than what we do, but they complement us and they help us push health equity forward around getting food to millions of people that desperately need it.
Yeah, I mean, like even the big players in the space, Walmart, Kroger, they occupy 5-10% of someone's food wallet and where people are getting food from. So like our view of the universe is that people eat in many different ways and places and formats, and we it's critical that we're partnering with all of those companies so that we have a picture of what our patients are eating. Also, Season doesn't make any money on food. We don't manufacture food. We help steer folks to the right option. So we make money on clinical outcomes and as a provider group. So for us, we're financially indifferent to who we work with, and but our food partners are really important to our business.
Yeah, obviously, Tata is not a startup. It's probably a $200 billion company. So we obviously work with startups. And I think in my perspective, there's always going to be competition is healthy. There's always a me too. But, the world is a large place. We have 7.8 billion people. So we all need to be together to play off our strengths and weaknesses to make it happen. So competition is good. It's a me too. That's still good too, right? It's the intent.
Yeah, and I'll add, and that leads to the next question. When you think about the robust need for access to healthy food across this country and globally, I think that even with the competition that exists, there's still so much more ground to cover. And it leads me to the next question. Low-income communities, especially those that where people live in food deserts, are disproportionately impacted by food-related chronic illnesses like diabetes, congestive heart failure. And even if food, meals, groceries are, $5 per meal, it's still incredibly expensive for a family to manage that long term. How do you all think about long-term affordability for the benefits and solutions that you all provide for the families who need it most?
I can go, please. Yeah. I think I'll go back to history, right? So farms were subsidized during the Great Recession, Great Depression, many years back. And corn, wheat, and soy, especially in the US, they were subsidized most. So what's found in subsidized most is found in abundance. So you'll see Fruit Loops being sold for $1, a bag of blueberries sold for $7, right? And then we talk about affordability. So it makes, to me, it makes no sense, right? So we all have to go backwards, change things systemically in order to go forward, right? But here we are, where we don't have access to good food or healthy food because it's really expensive. So then we have to go back to our traditional way of living, which is community gardens, education, growing crops at home, growing herbs at home. And I think that's really what it takes. But I think if we really, as a country, want to make a difference, then we have to start subsidizing, fruits and vegetables and really changing the ecosystem. And especially in the US, we have to start going seasonal and stop importing and having, every crop and every fruit and vegetable accessible, because that is not a very authentic way of existence, at least in this country. And we go across the pond to India and every other country, that's not what really happens, right? A bag of rice. People have simple foods. We don't have superfoods, which is imported. We have local foods, seasonal foods. So I think it's really changing the lens on not really, I would say, modernizing or putting food on a pedestal. It's really looking at food as nutrition and how do we bring that to the table in an equitable and accessible format. And that takes, I think, changing our policy and obviously our politics as well. But I want to get into that.
Yes, to everything you said. Building off of that, I would add that, we've really got ourselves to a place now, as if we just look at America, right? Just look at this country. We've got ourselves to a place with food that is very difficult to dig out of. I think that over, the next 3 to 5 years, so there's the 1115 waivers that are coming out in Medicaid that are designed to really take a look at if we provide food to members that have type 2 diabetes, hypertension, cardiovascular disease, how will we reverse these outcomes? So I think in the next 3 to 5 years, there's going to be a budget within healthcare that says you have to give, I don't know if it's $10, whatever it is, a week or a month that goes out to the member. That I think is coming. It also goes back to education, right? So, during the Obama administration, our children had salad bars in the schools, and these salad bars are disappearing. Home ec has pretty much been taken out of all public schools. There's no funding for it. So kids are not growing up with the knowledge of what is a cup of fluid? How do I cook? How do I, prepare my own food? So I think that has to change. And I think the conversation now really has to begin at youth of teaching children how to eat healthy. And, you know, the accessibility, I was actually just on stage a couple months ago with Josh, your co-founder, and we were talking about that food deserts are a very real thing, but like they can be eradicated overnight. Like I deliver everywhere FedEx goes, like Instacart delivers to something like 95% of the country or something. So they can be eradicated. It's the affordability and it's the education of teaching individuals how to eat healthy as well.
I think the other encouraging thing here, especially if you're a payer in the room, is you don't have to hijack someone's entire diet to drive pretty significant medical outcomes, we found, right? So season, typically we see our patients eating like 30 to 40 meals a month through season. And one of the reasons they do that is we use payer dollars to help subsidize some of that food. But we see, 1.5 drops in HbA1c, significant reductions in BMI. And so you don't have to overnight change the way entirely someone eats to start to manifest those outcomes. So I do think, nominal financing of food makes a big difference. And so that's what I would take away too, is like, we can all help with affordability of food, and you don't have to pay for someone's food for the rest of their life to get outcomes from that.
Thank you for sharing that. And especially now we see there is tremendous data that shows something that, in my opinion, is somewhat obvious, that healthier food will help people live healthier lives. But there are still skepticism, especially in the healthcare space. Talk to us about how we change that narrative, and perhaps some things that you are seeing in the culture changing to understand and engage with how food can improve outcomes.
Yeah, to me, there's like two things on that front. One is, I think there's still confusion at a macro level around who should be paying for food. So particularly when I talk to Medicaid plans, they're sort of pointing at the government and the SNAP and WIC programs that have been super successful, but and saying like, food's already covered and I don't need to take on that burden. So I think more delineation around, where the onus and value lies is going to be important. I echo what Ashley said around like, we're all in the midst of clinical trials right now, and some of that research is manifesting right now. So I think that needs to probably change. The other thing that we were talking about in my breakout group was the attribution of the risk dollar. So we're all, as startups, we're all going after clinical outcomes. We're all overlapping each other. And so I think a little bit more grace from, we sell to payers predominantly, but around like, hey, did season impact this ED discharge, or did Virta Health? It's going to be impossible to start to really piece this out. So I think we need to think a little bit more leniently around like who actually drove the outcome, or this is going to go nowhere,
So when we started off in the market, we took a different approach. So we did not take the approach of the ridiculous, obvious idea. If you eat healthier, you're going to be healthier, right?
Heaven forbid.
Because no CFO of a health plan wanted to hear that from me. So what we did was we said, we will engage your members in quality outcomes. What is that? STARS, HEDIS, CAPS. And we said we believed that we could get members to go get their flu shots, go get their diabetic eye exam. All of these measures they have to do around their a plan STARS rating if they're a Medicare plan, and HEDIS if they're Medicaid. And they didn't think that this was possible. They didn't think that people were going to go and actually go get their flu shot and all these different things to get more boxes of food. And we did that to prove another ROI, because the ROI for us when we started out was going to take too long if we could even get a plan to work with us to prove out, and to your point, Was it Season? Was it Virta? Who was it that caused the clinical change, right? So it's an instant, right? It's an instant ROI. If we send someone in a cohort of the FarmBox RX program, and I have the lucky factor that most health plans give me non-engaging populations, so those are always really fun. And if they go get their flu shot and they're part of this cohort, it's a claim. We know they do it, they'll self-attest, or it comes through claims data to us. And that's the ROI that we took to get other plans to work with us. And we proved to be one of the best care management interventions that Molina Healthcare has ever done in New Mexico. So think very rural population. They, of course, gave me a population that had never engaged with the plan. In fact, they had never even complained to their health plan. We just did another with a Medicaid plan in Tennessee of a large national payer of members that in this cohort had not had a claim in 2 years. And they said, if you can move the needle with this population, we'll expand you nationally. We've almost hit 20% of this cohort going and having a claims data come in the program. So it goes back to people want to be healthy, people want to eat healthy, they don't have accessibility, they can't afford it, and they don't know what to do with it. And if you give them the tools, they will take the self-efficacy journey.
I don't know how I'm going to combat that answer because she's working in the industry. But I think, when you're talking about food as medicine, we're really talking about how do we take healthcare out of their business, right? No doctor, no CFO, no CEO wants to hear this. Healthier people, no healthcare, no hospitals, right? So I think data is important, but I think humans are very complex, right? It's very difficult to tie anyone, including myself, to say, hey, Simi has been eating healthy for the last 15 years, but she still has, say, maybe cancer. How do we tie this up, right? Sometimes our bodies are very complex. There's genetics, there's lifestyle stressors. So I think data is important, but it's very complex to correlate eating healthy with certain parameters. But I think consistently, sustainably, if there are KPIs and metrics, which is reverse of, say, blood pressure or diabetes, then there is a data point to find ways, like Ashley and Season Health has found ways to integrate into the system to really make changes in a personal format, but in a way where we don't take healthcare out of business, right? So I think it's a very fine line we play with, where we want to do well, but also, play the business card. That's my perspective.
And we think about these interventions. How does technology play out in this ecosystem, both domestically and internationally? Is it just a means to get food from point A to point B, or are there more complexities that drive this engagement?
So I think, our roots as an organization are actually kind of born out of our partnership with Geisinger. So the question that Season was asking when we first started was, could we take the sort of famous results from Geisinger's fresh food pharmacy program and bring that online? So we have a telehealth-based group of registered dietitians, and then we also have a network or platform of food partners that we steer our patients to help find healthy and in some cases subsidized food. So tech plays a role in all of that. It's kind of the underlying infrastructure of what we do. I think that there is a lot, apart from just connecting folks to the right food and getting it delivered, which is a huge endeavor and very technically complicated. There's a lot that we can do around just basic like nudges, chatting with people, that I think actually sustains and scales these programs. It's a huge part of what we do, at least.
So I talk about Techquity a lot because I think that's actually the next frontier. I joke that I'm never going to do another startup again, but if I did, it would probably be around Techquity. But a big part of our population is Medicare, right? So 65 plus. My grandparents are actually better on the iPhone than I am, but a lot of 65 plus population is not. So we've taken a more low tech approach, especially for that older population, because sometimes you don't have to always get ahead of your skis of putting too much tech to try to engage somebody. Because again, at the end of the day, we're a patient engagement company. That's what we identify as. Yes, we're food as medicine, but we're a patient engagement company. Like our member call center, people will call and talk to our agents for 30 minutes, like about their grandkids, right? That has nothing to do with their Farmbox order, but they're lonely, right? We're combating loneliness too. So we like to say that we really engage our populations inside the box, inside every box that comes to the door, any order, no matter if it's medically tailored meals, a produce box, dry goods box, it has content in it. There's a magazine that goes out and it's, co-branded with the health plan as well, around what the health plan is trying to get the member to do. And we take that, we like to call the delightful referable moment of inside their house to engage them. On a tech basis, I mean, yeah, there's a tremendous amount of how do we get the food, like from the facility through FedEx to, to the person, and how do we measure, like what is our need going to be for the next, 6 months, 3 months, next week. Claims data that comes in, us digesting that to see who gets more boxes. But as far as engaging the population, we don't take a huge high-tech approach. Going back to, we say you don't always have to get ahead of your skis.
Well, if you need a tech equity business partner, then right here. So great question. It's my field. But some of the things, for food to become accessible at a global scale, we do need tech, like supply chain, data analytics, insights. There are a lot of emerging technologies. One of my favorite recent ones, which you all have heard about, is digital twin. The ability to replicate a person or a system and to feed it different variables to predict what the response would be. So, for example, I had to pick up a plant, replicate that, and give it different pesticides or different, fertilizing soils, and feel and see how it's going to react over the course of 1 to 5 years. Now I've reduced my cost, now I've reduced my resources, and I have these data points in my fingertips within a few, hours, right, to make that decision longitudinally. So the same can be applied to a person, can be same applied to a hospital system, same applied to supply chain. So that's one exciting emerging technology or existing technology, I would say. And the other ones are also, there's a lot of predictive AI companies that is being attached to IoTs and sensors to plants, where people can figure out when the plant is going to decay or what's the next stage of the plant going to be, so they can proactively inform the farmers on what they need to be doing seasonally, right? So I think technology plays a very important role, and obviously I could have answered this with maybe ChatGPT in my hands, but that's the other side of it, right? So I think with technology, I think we still need humanity, because without humanity, I don't think we can have that empathetic touch, but we need to practice ethics. We can all misuse when given too much power, so I think the same goes with technology. I think we need ethics and empathy when we implement that.
Thank you for that. And I'm going to move to questions to the audience, but before I do, I have one last question for you guys, and maybe 1 or 2 sentences. What would be a call to action that you would give from your prospective organizations or food as medicine as a whole, that the audience could walk away with? And I'll let whoever's ready to go first, go first.
I continually go back. I say this from the top of my lungs. Please always remember, just because somebody is low income does not mean that they do not want to eat healthy or they don't want to be healthy.
And I'll say, it's your health. You have power to it. What you feed yourself, what you think, what you do physically, it's all within your control. So I hear in a lot of my talks, people will talk about, trying to change the policy, and, the weight goes to the external party. I think it starts within you at home. So I think the more control you have, the less visits to the hospital. And I don't think we won't have to get these talks anymore, but that's my takeaway.
Yeah, I mean, I think I'd probably echo Ashley. Like, food is just an incredibly emotional topic, and people are very sensitive about what they eat and why they eat it, and it's a very entrenched part of our lives. But the flip side is, because of that, that's why it's so engaging, and so it is possible to capitalize on the, emotions that people have around what they eat. But the flip side is you can mess that up pretty royally, pretty quickly. So it requires a lot of thought.
Thank you for that. And here, I'll add one. please think about looking at patients as partners. If we're thinking about how we want to improve communities and health outcomes, look at how the community can partner with you. And I'll turn it over to questions in the audience. Here, right here.
So this was a great conversation, by the way. Beyond delivery of food, if we think about preparation of food, Western cultures, particularly in the US, don't prepare food in a very healthy way. So unless you're eating a mostly raw diet, you could have the most wonderful food in the world, and it could either get spoiled or not prepared correctly, and still not driving the outcomes that ideally you want to drive. So how are you planning to address the aspect of food preparation and avoiding waste and things like that?
Such a good question. I'll at least start from the season perspective. So a big part of our intake and sort of first conversation with patients is exactly around that. Like, what are you comfortable with? What do you have in your home? Are you cooking today? And based on what we learn about that patient, we will typically, if someone is like really on one end of the spectrum and not comfortable in the kitchen, we'll start them on medically tailored pre-made meals. So we start kind of sending them food that they don't have to prepare. And then we go on sort of that journey with that patient to transition them to starting to feel more comfortable, getting the supplies that they need, et cetera. A lot of the recipes on our platform, I will also say, are like pretty foolproof in terms of how you prepare them. So that, that's kind of the next step is, can we get someone boiling water, making oatmeal? And so, a lot of what we do is not super sophisticated, like high-end culinary stuff. But that's great, and that works for folks. The food waste thing, I think, is a big challenge, because you grapple with delivery costs go down the more food you send someone, and there is sort of a tipping point on expense that's very real there. We try to do a lot of work around making sure we're sending folks ingredients that they can make multiple recipes from, and we know what we sent you, so we can recommend things in your house to sort of optimize for food waste. If we sent you cumin last month, like what else can we make with that cumin? But yeah, I think that's a really important question here.
I'm gonna go to the next question just before Antoine weighs us off the stage. All right, go ahead.
Hi. Thank you guys again for speaking today at the conference. I just had a question just as far as like your ideas on land ownership, because I feel like that's a huge part on cost. So in other countries, let's say like Cuba, for example, where the government owns majority of the land on that island, what is sort of your idea of land ownership sort of being taken over by a government entity so that we can sort of regulate food prices and manufacturing and production?
I feel like this is right up your alley.
Yeah, I was like looking at me. Great question. This always goes back to the history, right? We have to acknowledge the history in order to move forward, right? So I don't want to get into the topics of sexism and racism, but that plays a huge role in America. So I don't know if United States would ever do that, but I think if that is more democratized, where everyone has access to land, there's community gardens, and where we can grow crops, then I think it sounds great. I don't know if we would get there. And then obviously access to land, the real estate cost is really expensive for us to individually do that. So I also don't think realistically we would get there. So then it comes down to how do we all be interconnected to maybe purchase a community land within a certain zip code to make that happen, right? So we can't independently afford it. If the government is not going to help, then it really falls back to our own ecosystem, building that trust and building that awareness for the futures to come. And I think that's the only loophole to make that happen, because we can wait next 50 years waiting for the government to make it happen. I would be surprised if that happens. We can wait individually for our incomes to go up to make that happen. But the only way we can do it if we rely on each other, we create a sense of community to make that investment, right? Yeah.
And just a follow up, are your companies doing anything to sort of foster that co-op mentality among communities?
So Tata background is mostly IT and tech. So if you're not aware of the company, we own Starbucks Coffee, we own Jaguar Land Rover, AirAsia. So we're very much on the tech side. We don't do farming, but 66% of Tata's revenue, which is $200 billion, 66% goes back to the community, mostly in India. So I'm sure that's distributed within the Tata Trust.
Yeah, I would say the furthest we've gone to date is when we started Season, we tapped into national food networks. So we're working with Instacart, Walmart, et cetera, to get folks food. And that's just, we had to start there. We're doing a lot more work now, to your exact point, driving more food revenue back into the community, back to CBOs, back to like local grocery stores, but we haven't invested in kind of that first leg of the stool into farms, et cetera. So it's a great idea, though.
And with that, I want to wrap it up. Thank you guys for such a great panel. I know I learned a ton today. And I appreciate it. If you guys have more questions, I know there were some more questions in the audience. We'll be able to catch us on the side. It's a great panel. Thank you.